February is traditionally the month to focus on heart-related issues. That includes an annual reminder to take care of your own heart and protect against heart disease. Joining us today is interventional cardiologist Dr. Ryan Hollenbeck from Mercy's Heart Center. And Ryan, heart disease has been the leading cause of death for both American men and women. Why is that?
Yeah, thanks for having me. I think the most concerning thing is that according to the American Heart Association, the majority of those deaths are preventable. So I think there's a few main reasons. One is I think there's a lot of people that don't understand that they're at risk. Maybe they don't have a relationship with a primary care provider, they don't know their blood pressure, etc. I think another reason is that a lot of people still smoke. Smoking rates have declined, but it's still a modifiable risk factor. And then the third reason I think is that there's a lot of people who may understand the signs or symptoms of heart problems, but they tend to ignore them or wait till it's too late, and I think that's a problem.
Well, what can we do to improve heart health?
Yeah, so one of the first things I think is to establish a relationship with a primary care physician or primary care provider to help make sure your screening is up to date, you know what your blood pressure is, know what your cholesterol is. They can help you work towards things like smoking cessation. And then I think most of us, at least most of us in Iowa here, could make dietary improvements, including myself, making better food choices, working on portion size, things like that all make a big difference over the long run.
Well, treatment options, they've really come a long way. What are some of those treatment options that are really exciting to you?
Yeah, well, so I'm an interventional cardiologist. I do a lot of procedures in the cath lab.
Sure.
And if you think about it, our field's really young. I mean, the first coronary stents are just 30 years old. And so the rate of innovation has been pretty remarkable. So now we can, replace heart valves without open heart surgery. There's a lot of new technologies coming down the road that aren't available yet, but procedures that may reduce your blood pressure without limiting the amount of medications you need. Valve technologies just exponentially growing, so there's a lot of exciting things.
People watching this right now are probably thinking, I have to improve my heart health. So what can people do to immediately start to improve and see those strides?
Yeah, so I think becoming more active, picking one thing and doing a little bit more than you currently do, I think is really helpful and can add up. And then I think the other thing is, I'm from Eastern Iowa, and I know the quality of a restaurant here is judged based on how full you are when you leave. And I think portion control and trying to make some small dietary changes can really make a big difference down the road.
All right, well, thank you, doctor.
Thanks.
And Monday,